Hello everyone, welcome back to my channel. If you're new here, don't forget to like, share and subscribe for more information on musculoskeletal health, that is bone and joint health. Today we are talking about something that can make a huge difference if you're preparing for surgery, pre-rehabilitation. You've heard of rehabilitation, right? It's a recovery process after surgery or injury. But what if I told you that you could prepare your body before surgery to make recovery easier, faster, and less painful? That's exactly what prehabilitation does. Let's dive in. What is prehabilitation? Prehabilitation or prehab is rehabilitation before surgery. It consists of three essential components. Number one, increased physical activity. Number two, nutritional improvements. And number three, better mental health preparation. It's been widely used in cancer treatments with great success, helping patients recover better and faster after surgery, chemotherapy, and radiotherapy. But what about orthopedic surgery? Shouldn't we be using prehab before orthopedic surgery more often? Today, we are going to focus on physical activity. The problem with current surgery preparation. In the UK, over 835,000 patients are waiting for an orthopedic surgery, and 45% of them wait more than a year. That's a long time without structured support. Here's what usually happens. Patients experience joint pain and see their general practitioner. They may get physiotherapy and an X-ray or MRI scan. If surgery is needed, they are placed on a waiting list, but physiotherapy stops. Yes, unfortunately, yes, physiotherapy stops as soon as the patient is placed on the waiting list. After that, and once on the waiting list, patient wait months or even years without an exercise program or guidance. This lack of activity leads to weaker muscles, less mobility, and a harder recovery after surgery. But what if we could change that? That's where prehabilitation comes in. Why do we need prehabilitation? To understand why prehabilitation is essential, let's quickly talk about arthritis. Osteoarthritis is a slow degenerative process affecting the joints. The ends of bones which form joints in the body are covered by smooth, shiny cartilage that allow the bones to glide over each other. In osteoarthritis, the cartilage becomes thinner, the joint stiffens, and even the muscles, nerves, and ligaments are impacted. When the pain becomes unbearable, total hip or knee replacement surgery is often recommended. But here's a misconception. Many people think there's nothing else they can do while waiting for surgery. That is simply not true. How prehabilitation helps before surgery? Number one, it reduces pain naturally. Exercise dampens pain signals sent to the brain. When there is injury or inflammation, the body sends the pain signal through a series of nerves. Inside the nerve cell, the pain is carried as an electrical charge. However, between nerve cells, the signal is carried by chemicals called neurotransmitters. Different neurotransmitters act differently by both amplifying and dampening the pain signal. When we exercise, the pain signal to the brain is dampened. Exercise also releases a natural painkiller called endocannabinoid. This not only decreases pain but also elevates one's mood. Endocannabinoids released by the brain are why runners feel so jubilant at the end of a run. This is known as the runner's high. Number two, exercise strengthens muscles for stability. Exercise also strengthens the muscles surrounding the joint. When the muscles are strong, the joints move smoothly and in perfect paths without instability. When the muscles are weak, there may be instability as the joint moves. That instability may increase the friction between the joint surfaces, which will only make the pain worse and increase the wear on the joint surface. Number 3, it improves blood circulation. Better circulation means more oxygen and nutrients reach the joints, supporting repair and regeneration. Number 4, exercise leads to faster recovery following surgery. Stronger muscles help reduce hospital stays and one can go home earlier. It also lowers the chance of infection and decreases the risk of other complications. Patients recover faster and return to their normal lives sooner. Now, more important, breaking the wear and tear myth. Many people believe osteoarthritis is caused by wear and tear and that exercise will make it worse. That's not true. Our bodies aren't like our cars that wear out. Last summer, I was cycling and fell, injuring my left elbow. I cleaned the wound and left it alone. After about 3 weeks, the wound had completely healed. When the healing was complete, the skin was dry and smooth like before. There was no redness or inflammation. Let us compare my injury to what happened to my car around that same period. As I was reversing out of my driveway, I scratched the fender. I did not bother to get it repaired. It is now over 6 months and the scratch is still clearly visible. The car does not have life and cannot repair itself. But our bodies have life and can repair themselves. So osteoarthritis is not wear and tear arthritis, but wear and repair arthritis. If we exercise and make the muscles strong, the repair process kicks in, and we can compensate or reduce the wear that occurs in the joint. The example I just gave clearly shows the difference between objects that have life and objects that do not have life. Our bodies, including our joints, have life and can repair and regenerate themselves. Objects that do not have life, like my car, cannot repair and regenerate by itself. The Danish success story, the GLAD program. Denmark runs an amazing prehabilitation program called GLAD, Good Life with Osteoarthritis Denmark. Here's what they found. In a research study of Prehab before total hip replacement surgery, 40% of patients who were listed for surgery did not need the surgery for up to 2 years while they were having Prehab. In another research study of Prehab before total knee replacement surgery, 68% of patients who were listed for surgery did not need the surgery for up to 2 years while they were having Prehab. A similar study from 2014 showed that 52% of patients with hip and knee arthritis participating in an exercise and education program decreased their use of painkillers, of which 18% were able to stop the painkillers altogether. Nearly 1/3 of the patients using opioids and morphine were able to give it up. This program is now in Canada and Australia, and the results are outstanding. So why aren't we doing this everywhere? So what are our final thoughts? It's time to change the way we approach joint surgery. Prehabilitation isn't just an option, it's a necessity. Whether you're waiting for surgery or just want to keep your joints strong and pain-free, start moving today. If you're looking for the best exercises for hip and knee arthritis, check out the links in the description below. If you found this video helpful, don't forget to like, subscribe, and share to help spread the word about prehabilitation. See you in the next video. Goodbye and stay active.